The guilty verdict of Derek Chauvin for the murder of George Floyd offers a modicum of justice for Mr. Floyd's family and friends, our community, and our nation. The ongoing issue of institutionalized racism, discrimination, and law enforcement targeting Black people remains a grim reality that we must continue to recognize and confront. We are in solidarity and support of our Black students, colleagues, friends, and family members who are particularly impacted by targeted violence and its emotional aftermath. The verdict was an important milestone, but the real work lies ahead. Black Lives Matter.
Good evening, everyone. Thank you for joining us at the Bellevue College Foundation's Learn, Engage, Invest Speaker Series. We would like to begin our evening with a land acknowledgement. We pause to acknowledge that Bellevue College resides on the traditional land of the Coast Salish peoples. That includes, but it is not limited to, Snoqualmie, Suquamish, Muckleshoot, and Tulalip peoples, past and present. We acknowledge that we are on the traditional land of the first people of Seattle, the Duwamish people, past and present, and honor with gratitude the land itself and the Duwamish tribe. We remember their connection to the region and recognize their suffering due to systemic oppression. We commit to using our education and agency to acknowledge injustice and work to make systemic change in support of Indigenous rights, including federal recognition of the Duwamish. Welcome to the Learn, Engage, Invest Speaker Series. For the safety of our community and to do our part to slow the spread, we've decided to approach our annual fundraising event a little bit differently this year. As I'm sure you've attended many of these types of events recently, we are happy to be online and to be able to be safe in our homes and presenting from you here. With tonight's theme relating to healthcare, we wanted to extend our deep gratitude to those working in healthcare who have been going above and beyond in the most difficult of circumstances. Thank you. While all proceeds of this event will still support students at the Bellevue College community, but we still want to focus on the big topics that impact students, higher education, and the East Side community. Bellevue College is not in a bubble, and we know that the students who pass through this institution each have their own story when they enter. We will each have our impact on them, and they will continue to have impacts on others as they leave our institution. Thank you for joining us as we dive in with students, parents, alum, and experts in the community. My name is Jessica Berry, and I'm the Director of Operations at the Arts and Humanities Division here at Bellevue College. I'm excited to be helping out tonight. My former coworker, Gabriel Brown, was not able to attend this evening, and I'm happy to be helping her out. And even more excited to talk to you and our guest about the programs here at Bellevue College. Bellevue College has the #4 ranked ultrasound program in the nation. We have one of the 4 originating Bachelor's of Applied Science programs at a community college level. We have one of the very few radiation therapy programs or medical dosimetry programs available in the nation. While the accolades are too many to mention, I think our greatest achievement has been the number of highly trained nurses, radiologists, sonographers, and wellness professionals that we have trained and put out into the community. These students have impressed me continuously during my time as a program manager in the Health Sciences Division and continue to surprise me every time I run into a BC graduate in the healthcare world. You too have likely unknowingly seen or been treated by a BC graduate. You should ask next time. You would actually be really surprised. Thank you to the many individuals that have already made a gift in support of the BC students. Thank you, seriously, thank you. For those of you who haven't, thank you for joining us, and we hope by the end of this evening, you'll consider making a gift as well. I want to take a moment to thank today's generous corporate partners. This event is only as successful as the partners who support us and the work that we do. I'd like to express my sincere gratitude for this year's signature partners, BECU, and Overlake Hospital. Lots of students at Overlake, just ask them. We'll soon hear the stories from amazing alumni and community partners. There are so many stories like theirs at BC, stories that are made possible thanks to your investment. Thank you so much for being here today. And now it is my pleasure to introduce Bellevue College's interim president and former Washington State Governor, Gary Locke.
Hi, I'm Gary Locke, interim president of Bellevue College, and I'm so excited to welcome you to our third and final night of our Learn, Engage, Invest speaker series presented by the Bellevue College Foundation. These virtual events have been a great opportunity to connect and build relationships while safely navigating the pandemic. And we've already learned so much together in facing such an enormous challenge. As a college and as a society, we've re-envisioned the way we learn and work by creating accessible spaces online, adapted quickly to meet the needs of those we serve, relied on our shared community while deepening understanding of the many ways we're all so connected. In this last night of the series, we're going to take a deeper dive into community building with BC's subject matter experts as well as experts from the Bellevue area. We hope you'll take away insights you can apply to your own lives and also share with others. As always, thank you for your continued support of Bellevue College, our students, and a better, more equitable future for all. Tonight, we're going to focus on community building. As a result of the pandemic, we've had to come together and rely on each other in truly unprecedented ways. And nowhere has this been more apparent than in our community's healthcare system. This past year has exposed systemic issues and vulnerabilities related to healthcare on both a national and local level. Well, how do we address these Herculean challenges? As a community, what solutions do we need to implement right away to ensure everyone can live long and healthy lives? And how is BC serving the healthcare needs of the local community? And how can we do more? I think the lessons we've learned along the way this year in healthcare can, quite frankly, be applied to just about any industry or organization. Our discussion this evening will be guided by Gabriel Brown, Program Manager for BC's renowned Health Sciences and Wellness Institute. And Gabriel will be joined by Sofia Aragon, the Executive Director for the Washington Center for Nursing, as well as Patience Chikava, a BC alum who works as a radiation therapist at the Swedish Health Network. So without further ado, here's Gabriel.
Thank you, Governor Gary Locke. As a reminder, my name is Jessica Berry. Gabe wasn't able to make it this evening. She's very sad that she couldn't be here, and I've had the opportunity to work with the staff and the faculty in the Health Sciences Division, and they're all amazing people, and the students that are in the Health Sciences Division have been absolutely incredible. I'm really excited tonight to introduce to you Sofia Aragon. She's a registered nurse and has a BSN. She's the executive director of the Washington Center for Nursing and also serves on the Burien City Council. Sofia engages in health policy, environmental health, and nursing workforce development, including building a diverse healthcare workforce. It is my honor to welcome Sofia Aragon.
Good evening, I'm Sofia Aragon. I'm a registered nurse and the executive director of the Washington Center for Nursing. And I feel really honored to participate in this Bellevue College event, knowing that everyone is gathered here to support all of the students that you are engaged in for their professional and career growth, and coming all over from a very wide geographic area in King County and also all over the world. Bellevue College has such a great potential to create opportunity for students as well as the region. Prior to COVID, around 2018, I know that sounds like decades ago, our Puget Sound region was really headed into a crisis in terms of the significant amount of growth that we were all experiencing. And as a member of what is known as the Health industry leadership table. And that's an effort of county-wide to fill almost 750,000 jobs in the greater Puget Sound region to support our growth. As we got together and talked about, what are the priorities in terms of careers that we should be promoting, healthcare became number one. And as we delve a little bit more into healthcare, long-term care became the priority in the healthcare sector. So I know that many students coming out of Bellevue College will be joining healthcare and also choosing long-term care as a career. And to me, that just gives me so much hope, because now that we are trying to manage and respond to COVID-19, we need a really strong workforce more than ever to be able to not only put COVID-19 behind us and overcome it, but also be prepared for any health crisis that might come onto our community. I look at the many years I was a registered nurse. I've been a registered nurse now for the last 25 years, and we've seen very similar yet smaller events happening just even within the last 10 years. So if you think about SARS, you think about bird flu, you think about the Ebola virus that fortunately didn't hit the United States, but we were certainly aware of it in another part of the globe. Because of the nature of our communities being such a global community, it would be more and more likely that we will see worldwide pandemics like COVID happen in the future. So this is a really great opportunity to learn from this experience and be stronger from it. And that leads me to my second point. In terms of everyone in this room, I hope is thinking about, how are we going to take the opportunity to be leaders? So for students learning a new health profession, to really aspire to how are you going to make a contribution beyond being a really skilled and competent professional. Healthcare professionals are looked upon by their communities as not only experts in their fields, but also very trusted. And they're trusted because they committed themselves to help the health needs of the community. As you know, healthcare impacts everyone. A health professional is there when you're born. A health professional should be there whenever you're ill or you need healthcare advice or treatment. And the health profession should be there when you're exiting and you're at the end of your life. So we are able to make a difference to everyone at every point of their life. And, in terms of leadership, you can certainly excel in what you do, but because you're a trusted voice, you can contribute to so many other ways that strengthen our civic community overall. For example, I served on the board of a group that really wanted to tackle homelessness in the region, which everyone knows, despite the prosperity of our state and our region, that the homelessness issue really skyrocketed over the last 10 or 20 years. And health professionals have really been an effective messenger, showing how unstable housing can also relate to unstable health. So that it's really important that people have these societal foundations to feel secure and to be safe and to succeed in order to have good health. So you can really make an impact beyond healthcare. The other thing that I hope people are really thinking about is really commitment to continuous learning. So previously, when I started this discussion with you, I talked about pre-COVID. Well, the entire world, you and I have learned so much from this COVID experience, and we're still learning because we are still trying to learn together as a community how we're going to overcome this and what are we going to learn from it afterwards. Being at a local college system is a perfect place to maintain those connections with continuous learning and be on top of innovations and the needs of employers and other service providers around us, because the beauty of institution like Bellevue College is to really be in tune with, what are those skills and the attributes and experiences and roles do they need to be successful and to contribute to the community. And I know as a health profession, healthcare continues to evolve, and we've always been rapidly evolving. We have a great opportunity to really develop new technologies for patient care. We know more about what impacts people's health. I mentioned earlier about, one of the unique ways a health professional can contribute is talking about and advocating for those things in someone's life that creates that stability and therefore better health. One interesting fact that I share with people frequently is that, when I was a nurse in a hospital in Seattle years and years ago, as a provider in a clinical facility, I really can only impact 20% of what determines somebody's length of life and their quality of life. However, there's so many other greater things that impact somebody's, again, quality of life and length of life, and those are called socioeconomic factors, housing being one of them. And where Bellevue College really contributes to these set of social factors that we call social determinants of health is education. It's really been long established that the more people are educated, the longer they will live, and the more they have the ability to prosper and therefore have quality of life. So those are the things that I'm hoping the audience will keep in mind. Is first, I want to thank everyone for their service, providing wide access public education like Bellevue College is so needed, knowing that students have a place of excellence that they can choose to go with fewer barriers than other institutions is absolutely necessary for our continued prosperity in our society. Second, also think about where you want to lead and think big. I know that people are already leaders on this webinar because they've chosen a career path to make a difference. But you can do more given your interest and your curiosity and what you see are needs out there in society. So I really encourage you to think big in terms of how are you going to be a leader in your community? And then finally, really encouraging people to commit to continuous learning, because that's where we all are throughout our society as our world changes, as it expands and becomes more global. We're going to be taking on more global challenges that'll hit very close to home. And only continuous learning will allow us to keep pace and keep up the skills and be able to respond to whatever comes our way. Well, in terms of what's happening in our current system now, and how do we support the mental health of health professions out there fighting COVID for us? I think the truth is it's hit and miss. I think people are really what their intuition says is this is an incredibly stressful environment, and healthcare has already traditionally had concerns about how do we prevent burnout among employees. And burnout is particularly a difficult issue because it happens before a person even realizes it's happening to them. And I often envision that, someone just may hit a wall or just decide, I can't be in this role anymore because I'm tired and I'm frustrated or for a number of reasons. And then we lose them. We're unable to address the problem before they leave. But I think COVID-19 has given us an opportunity to look at that more seriously. I'm seeing more schools of nursing, for example, saying that administrations are coming forward and investing in student health. Also making sure that there might be some resources that students will need at this time. For example, housing. so that they may get some assistance if needed, if that is the case, so that they can continue with their studies. And I know as being part of the nursing community, we are sharing strategies that employers have. And also, what's really important is to really listen to health professions on the ground. There is a study that the Center for Nursing is doing right now called The Impact of COVID-19 on the Nursing Workforce. And we had a specific discussion on mental and behavioral health, really supporting nurses through this time. What's the problem and what can we do with it? And it was this interesting discussion around employers have the really good intention of providing mental and behavioral health services, but as staff nurses, they may not see that. So there might be other structural things that we have to seriously look at. For example, the type of hours people are working when we're dealing with extraordinary circumstances with COVID-19. We all know that there were issues with equipment, such as not having the personal protective equipment or PPE that was needed early on, and not being able to practice those, I'll say, generally hygienic standards in using PPE just simply because there wasn't enough. And people had to be creative, but that only could do so much. So there's a lot more to do in mental health. I think looking back on my 25 years as a nurse, I think the good news is there isn't as much of a stigma in mental health, meaning that people are more willing to come out and talk about it. And there's been much more education around it so that nurses and other health professionals know that there are resources out there to assist them when there is an issue. In COVID, I think that the technology of telemedicine has really blossomed in mental and behavioral health. And I'm hoping that that's one of the lessons learned in COVID, that perhaps we can use this telehealth technology to provide more mental and behavioral health services to health professions and patients, and just making it even more accessible so that we are more effective in addressing behavioral health issues related to the workplace. In terms of a program or activity that's helping elsewhere, that's happening elsewhere, that I wish happened more here locally, the Pacific Northwest has really been a gateway from other people of other countries who have educational backgrounds in healthcare. Clearly, we have a strong tradition of that in technology. I immigrated here at the age of 3 with my parents for the same reasons that other immigrants do, is we're here to look for opportunity, right? Coming from places where there are none, or there's gigantic disparities, prejudice, prosecutions, and we just wanted to live a better life, or at least my parents wanted to have a better life for their children. I was the only daughter at the time, and they were very educated health professionals in the Philippines, and left everything behind to come here when around the time that the Philippines declared martial law, and it became just too dangerous to live there anymore. And so when my parents came here, they had significant barriers carrying out their professions. My mom in particular was a registered nurse of 10 years already when she came here. And she was never able to obtain registered nurse licensure. And, at the time I didn't understand it, but as a workforce development professional, I understand how difficult the licensure tests can be, right? And today as a registered nurse, I've been through that myself. And I know the high standards that the United States expects of its nursing students to earn that license. But it's a very different circumstance when you're someone from another country, having gone through and completed their education successfully there and have been out of the educational system for 10 years and come here and have to compete with students who are fresh out of school and understand what's needed to be done on these tests, right? And so I think that we're really doing ourselves a disservice if we're not supporting graduates of schools in foreign countries for health professions. I do agree that when they come to the United States, that they need acclimating. So this is how our system here is different. There might be different terminology for diseases or conditions, medication. The technology may be very different. So here in the Northwest, we've been pioneers in technology and have, very sophisticated systems, which someone from a foreign country may need to be trained to do. We have some requirements and some specializations that may have not been offered this person. But what they need is specific training in that area so that they do capture whatever gap in education they have. And also just the system itself to navigate in order to register for and take the licensure exams could be costly and time consuming and not be available to a foreign graduate at the same way that a mainstream United States educated person might be. So I know that in other states, the community colleges have been really the center of providing supports to foreign graduates to be able to navigate the United States system for licensure. I know in the Seattle area that nurses are the largest contingency of healthcare foreign graduates, meaning that they're the largest group that needs that kind of navigation support. And I really think that we do a disservice if we're not giving that kind of support and at the same time saying we have a shortage of workforce in healthcare, which is actually the number one workforce priority in the entire Puget Sound region is healthcare. And this was true pre-COVID. And it's even more important now that we're in COVID and we're actually, we actually know and we anticipate that a lot of nurses are going to exit the field because of either stress or burnout, or if they have the opportunity because they can retire and had a long career and gave it their all through COVID. I hear my nursing colleagues say a lot saying, I'm committed to being a nurse till we see this through. But when things get back to normal, I'm not sure I could stay because it's just been really stressful. So I think foreign graduate nurses or other foreign graduate professionals just really need that support because they have a lot to offer. And that our region here is also very diverse globally in language. And how we are accepting of providing culturally appropriate care is so different now today than when I grew up. So when I grew up, assimilation was basically expected. It wasn't even talked about. It's just what we did. I remember going to preschool or daycare because my parents had to work. And my parents told me that when I entered preschool, I was fluent in Tagalog, which is the language, the national language of the Philippines. But then when I came home, I suddenly I refused to talk that language. I was talking as English that I knew, which basically didn't make any sense as a young child. And my mom just said, somehow I got the message out there in preschool that I couldn't speak my language. I wasn't going to belong. And clearly as a child, I was determined to just abandon that. And my parents let me. So even today, I can't speak Tagalog. There was a while when I lived at home through high school, I can understand it because I was around my parents, but I never spoke the language. But now people are expected to be culturally competent and also are recognized for skills like language, skills like cultural foods and customs, and being able to adapt to somebody's needs that are heavily influenced and connected by those cultural norms. And we as health professions are committed yet struggling. It's challenging to do that. But that's where we're going. And I think that graduates from other countries have given supports to integrate here in the United States. And we really maximize the skills that they have to bolster our workforce, I think is an important part of contributing to a more culturally competent workforce. So I wish more of that was happening here in the area, given that the Northwest is such a gateway from the rest of the world. So thank you very much. I really enjoyed sharing with you some of my perspectives, and I really look forward to more discussion.
Thank you, Sophia. I really appreciate your words tonight and look forward to talking to you a little bit more. Something that you said specifically when you were talking about the people from other countries coming here with their licenses and things like that, that was something that we experienced. So thank you. I look forward to talking to you. Next, we're going to hear from our one of our graduates, Patience Chikava, is a Bellevue College alum. She's the class of 2020. She was also a 2018-2019 Bellevue College Foundation Scholar. Patience is currently a board certified, registered in Washington State licensed radiation therapist with the Swedish network. And I had a moment to talk to her just a little bit before we started, and I'm really excited to hear from her. So let's hear from Patience.
My name is Patience, and I'm originally from Zimbabwe, which is a country in Southern Africa. After having lived in 4 countries apart from my own, I moved to Seattle, Washington in April 2015, together with my husband and 3 children. Moving to Seattle came with great opportunities, as I had been a stay-at-home mom for close to 20 years. But the time came where I felt strongly that I needed to invest in a career close to my heart. In 2014, just before the move to the US, I lost my father to cancer. I had watched and cared for him during his last 18 months, and the day he passed, I was by his side. From that day, I felt the urge to help people going through life-altering challenges of cancer and even other healthcare issues. I was inspired by the healthcare workers who cared for him, and I knew deep down within my heart that I wanted to do the same for others out there. This is how I was drawn towards applying into the radiation therapy program. However, starting this new career in my life was daunting and scary at times. I wasn't sure how I was going to adapt to this new and vastly different American system. In pursuit of this big dream, I discovered Bellevue College, which soon became my home. I had an amazing academic advisor who listened to my ideas and guided my thinking. Making it into the radiation therapy program, which is super competitive, was an amazing experience for me, which led to me meeting my wonderful professors and also working alongside my classmates, which was a life-changing experience. Throughout the program and during the internships, I learned more about who I am, what motivates me, as well as discovering my calling to this field. I found a comfortable outlet of empathy, passion, kindness, care, and support, traits which are natural to me. I learned to become confident in challenges and also learning to rise to become the best me. I deeply learned about respect and how to identify with patients who are experiencing different conditions and different levels of pain as they undergo treatment. This confirmed that I was born and prepared for this career and service. Graduating from the radiation therapy program and going on to write and pass the registry board exams has been the best feeling ever. I am now employed by one of the leading cancer centers here in Seattle, and in this increasingly changing field, I look forward to growing and gaining more experience and eventually rise and become a lead therapist in the not too distant future. I anticipate thriving, working, and caring for patients from different walks of life. My experience and education at Bellevue College revived and awakened my dormant professional dream. The college has so many resources to help anyone pursue and achieve a career dream, just like I did. The support I received from Bellevue College was amazing, and I deeply recommend and encourage others to do the same. There is so much hope. Bellevue College will be my home. I had a great experience, and I am forever grateful for Bellevue College.
Thank you, Patience, for sharing a little bit of your story with us. We appreciate that. Thank you. I wanted to make sure to invite everybody to put questions in the Q&A box. I can see those, and I'm happy to ask, and I'm going to invite our panelists back, and we can ask them some questions together. I'll be keeping an eye there, so please put your questions in there. We've prepared a few ahead of time just while you get your brains kind of going and thinking a little bit. So I wanted to thank Patience and Sofia both for being here. Let me get my questions up for you. Thank you so much, both of you, for being here. Sofia, I wanted to start with you because something that I hadn't considered before before tonight, maybe kind of a little bit in the distance, but hadn't considered it so much, is the impact of the healthcare field and housing, and how housing insecurity and some of those things are so related in many instances, but in particularly this year with COVID-19, we are seeing the impacts of the housing crisis even more, and how that is tied to the healthcare field. So your work in housing gives you insight. How do you feel COVID has impacted housing, especially for those that are most vulnerable?
Well, I think that what was interesting, and I'll share you a conversation I had with a local public health official today, and it was partly in my role as a nurse, but also because I'm on the Burien City Council, and I really want to make sure we're doing all we can for our community when it comes to COVID-19, particularly access to vaccination. And so we had this discussion around, what is the best next step as access to vaccine is increasing? I was particularly concerned that there were communities of color that already had more positive infection rates. They were already in a hospital more frequently. They were already dying faster and just more frequently than the white population. And I said, well, what can we do with those to help those communities now? My concern is that with greater access to vaccine, it'll just be harder to access just a sheer volume of people wanting to get it. And it was an interesting answer that I'm thinking about, how would we do this, is that there are whole families that have to experience quarantine because of exposure, also loss of unemployment. And so those are the things that cause trauma to people. So the advice to me was to think about, what are those social needs that we can support these families? Housing was definitely one. Also, we've seen the significant amount of food insecurity among families. And so when we think about the resources that may be coming down from the federal or state government to support families impacted by COVID, it's not just the vaccines and the direct healthcare, but how do we support them in housing, obtaining food, so that they're not experiencing even more trauma because of the pandemic?
Yeah, absolutely. Thank you. And then this question is kind of for the both of you. So something that you spoke about, both of you spoke about in a little bit different way, is what it means for people from other countries to come here, either, you know, kind of both. I wrote down a question initially, and it was one side of the coin as a healthcare professional. You know, I worked with the radiation imaging sciences program. We trained people in MRI and CT, but they already had to be licensed here. And that was very challenging for people who had been, you know, imagers been an imaging professional in their own country and then moved here. So I'd like to talk a little bit about that, but then also on patients' side, coming here and experiencing a very different type of healthcare. My husband is actually from Liberia in West Africa, and much of his family is here. And this is actually a conversation that we have quite frequently, is what is the difference in healthcare and how are we communicating with those people in a way that makes sense to them and in a way that meets them where they're at. So I don't know who kind of wants to go first, but I'd just really love to hear a little bit more of your thoughts on both sides of that, what it means to experience those differences from there to here. And then also, you know, what can we be really doing better for healthcare professionals that are coming from other places? I'd love to hear a little bit more of your thoughts on that.
I think I could go
first.
first.
You want to go first?
Well, thank you again for having me tonight. Well, my experience maybe was a little different because I didn't come in as already a healthcare professional. I actually went to Bellevue College to become a healthcare professional. And that was an interesting experience because I had another bachelor's, which I had to kind of transfer some credits. And that wasn't as easy as I thought it would, because some of the classes I had taken for that bachelor's were not accepted into the American college system. So that was kind of a setback where I had to pretty much take all the prerequisites I needed to take for me to get into the program. So that took me a little longer. But apart from that, just the experience of getting into healthcare here, and I would compare that with the care my dad got, because that was back in Africa. And there's more technology here. Obviously, we're in a better situation where we have better linear accelerators and technical things that we have here, which Africa probably does not have as much. So that will be the main difference, which I hope one day I'll be able to go back and make a difference where I come from. So it is a great honor and privilege to be able to practice healthcare here. And I see there's so much potential, there's so much greatness that we have to offer our patients and to yeah.
Thank you.
Well, and I think it is a nice comparison and contrast from what I'll share about my parents when they moved here to the United States. And, you know, as an immigrant family, I think you're often really isolated and think that the experience is unique to you. Luckily, we had a lot of family in the area, so we had some support. But I remember many years afterwards reading an article about healthcare professionals that immigrate here, and this, especially those who have a lot of challenges transitioning and obtaining the licensure for their profession here, is that what's really hard is when you're a health professional, it really is so much a part of your identity. It's not just something that you put away when you come home. It's always who you are. And so when you come here and there is hopefully just a small lapse in time where you either have to wait for applications to get processed or waiting for that time to pass that critical exam so you get your license, you really feel like you have lost a part of you. And the danger of that is that people can feel really depressed and feel very disenfranchised and not know what to do. And when you're a part of an immigrant community, that much more harder to reach out for support. So, you know, that's just something I reflect on, seeing my parents go through. And I think for those people who have the skills, and what they just need is assistance to navigate the system so that we can get through those requirements. You know, now me as a, just being, growing up in the United States, when it was time for me to take the nursing exam, I had resources my parents would never had in the Philippines. For example, there are organizations, as you know, to help you familiarize yourself with the exam. Immediately after nursing school was done, we had a whole month program to say, here's what the questions look like, get really familiar. You understand where your weaknesses might be in taking something like a multiple choice test, and get over that before you even take the exam, so you're in a much stronger position. People in other countries may not have that. So those are some things that I remember growing up be really significant challenges. And I think places like Bellevue College can help with that.
Yeah, absolutely. I'd also really, is something that I experienced when working with those students. And yes, that hearing that level of frustration in their voice of like, no, I don't think you understand. I've been a sonographer for 20 years. Why doesn't that count for something here? And I felt terrible. I'm not a healthcare professional myself. I worked, you know, with students who were entering the healthcare professions, but hearing those frustrations and not necessarily understanding how to help them, and having to send them back to a lot of those licensing bodies where they don't always get the answers that they're looking for. And then the licensing bodies tended to kind of send them back. And it just felt like this vicious cycle. It felt hard for some of those students, and I was happy when we were able to make something happen, but those did feel sometimes few and far in between. And I hope that is an opportunity for change in many areas in healthcare and how we do that. I got a question here for Sophia. What role do you think Bellevue College plays in addressing the problems you are seeing in the healthcare system?
Well, Bellevue is a really great place, first of all, to get that healthcare education in any field. And, you know, I think about this, all the offerings that you have at Bellevue, not only that you produce great nurses, but also our team members that are out there in healthcare with us. So I think that Bellevue is just having a health professions program is just so absolutely critical. And also, I also think about a place like Bellevue College is also someone who may, if they want to switch careers or go into a different field in health, they can do that there too. So it's just these options and opportunities for somebody to choose their career. And if they feel like they want to change directions, they have that opportunity too. So I think that's just the greatest gift that a place like Bellevue College can give a community.
One of the most exciting things for me is I'm a mother, and my oldest is considering a nursing or some sort of healthcare. And it's very exciting because I get to be the mom, but also the higher ed professional, and encourage that and say, well, you know, Bellevue has a great nursing program, or have you ever considered, you know, nuclear medicine, which was something I never understood. And once I got to work with some of those students, understanding what they did, and very, very cool to be able to kind of form a pipeline, and his school provides him opportunities to visit colleges and things like that. So that's very exciting. So for patients, as a recent alum, do you feel prepared for the world that you've become a part of?
I will confidently say yes. I love the radiation therapy program because it was very hands-on. So our first year of school was pretty much 3 days in class and 2 days in the hospital. So it was very hands-on. The second year was the opposite, 3 days in the hospital and 2 days in class. So everything we learned in class, you kind of put it into practice when you went into clinic. And the summers were full clinical, so we didn't have a summer break. It kind of felt like, oh, I want to just have a break. But it was amazing how much you get because you're in clinic the whole summer, like Monday to Friday. So by the time you're graduating, you're pretty much in sync with what the expectations are. And so finishing and graduating and then applying for a job, I really felt I was ready to do that. There were times I would think, will I be able to do this? I think the practical hands-on practice, the internships we had, that was amazing. And that's one of the best things that I really appreciate Bellevue College for, because we had the internships that were already set. All we had to do was to go and participate in those. And so when you're done with the program, you're pretty much confident in what the expectations are because you're hands-on.
Yeah. That's excellent. Okay, so I have another question for you both here. There's such a wide variety of healthcare professionals in many different settings here, lots of different modalities, sometimes lots of secondary modalities within your primary modality. What areas do you think our community or state are particularly strong in? And then also, where do you see that there is more of a significant need?
Well, I think healthcare in the community is something that I think the state has been trying to go towards for a really long time. Still today, the majority of nurses are in hospitals, and that's true in states and is true across the country. But in terms of cost control, in terms of, for example, our elderly patients wanting to age in place, that we really need to find ways to more effectively deliver healthcare in a community-based setting. Examples of that may be in schools. Schools are sometimes the only place where children can even access healthcare, which people don't really think about, but for some children, that's really true. And there's many mental and behavioral health clinics, for example, in the community. Primary care, we've always been really struggling with. And that's certainly something that we can help bolster. So I think that is something that with Bellevue College, and patients mentioned with health professionals, you know, we all go through clinical training to really think about if there are some community-based experiences to make sure that all students have some of that. Particularly if you're historically very hospital-based, there are ways that you can contribute to that community healthcare so that you can address those health issues for patients, and they may not even have to come in and receive care. You might actually help them through a healthcare issue while they're at home, as I mentioned before, either telemedicine or even when I was actively working in a clinic, we can do a lot with just a phone conversation. So long as we have the right information, we know what questions to ask as health professionals, we can very well either let the patient know what is the best thing to do next, or know those critical situations where you need to get help right now. And do you need me to help you get that? Or can you get to the hospital immediately with the help of family or friends? Or can we call an ambulance for you? So I think those are the things that I, at least with nursing, I know that more people need more skill doing.
Yeah. Sophia, I'm a mom of 5 and my youngest is 3, my oldest being almost 17. And I am so here for telehealth and virtual appointments, because there is nothing more taxing on a parent than having to load all of the children up in the car to get everybody to the clinic and then have my wonderful primary care doctor say, oh, yeah, it's just an allergic reaction, no big deal, go home. When I probably could have just shown her over a video and she could have said, yeah, put some Benadryl cream on that. So I that is one area that I am very excited in. And actually we see that a lot in we're seeing a lot of that in higher education also, where we're offering a lot of advising services online and things like that. And we're really trying to pivot the services that we offer to be in the evenings and where students need them. And I've heard from many students saying that's very helpful. So I imagine those feelings are probably similar in that way. So let's see here. I'm getting some messages, so I want to make sure that I'm seeing them. So I will pause just for a quick second. Oh, great. So I'm really excited to see one of our students in our audience. So that's very fitting for our next video. So I would like to, oh, not a student. Oh, I'm sorry, I messed up. I'm not sure what's happening here. So I'm getting messages, but I don't think I have the full picture. But I do think we have a video coming up. So I'll let them go ahead and roll that for you all.
Hi, my name is Tyler Willis. I am from Enumclaw, Washington. I am earning my Bachelor's of Science in Nursing in the RN to BSN Bridge program at Bellevue College, and I earned the Vasantha Daniel Nursing Scholarship. This scholarship ultimately made matriculation possible to the RN to BSN Bridge program. Bellevue College has so many amazing instructors and faculty that I honestly feel bad naming only one person, but for all intents and purposes, through the RN to BSN program, I've been lucky to have Kevi Wajaya for now 3 quarters. In my 3rd quarter, that was when we were doing our clinical fieldwork hours, and I served a lot of them at Kevi's clinic, Stepping Stone Pediatrics, rendering COVID vaccines and serving about 100 to 200 people per day, and then over spring break as well, serving underserved clients of Bellevue at the YMCA, and that was through a partnership with King County Public Health and PHRC, but organized by Stepping Stone Pediatrics. And it was a really amazing event. 480, I think it was 484 or 486 clients were served that day. Anyway, Kevi has opened my eyes to my latent desire to do community and public health, and also become a nurse practitioner. And he was one of my recommenders for my application to UW's DNP program. Thank you, Vasantha Daniel, for awarding me this opportunity to further my career and better serve the needs of my community, and ultimately one day become a nurse practitioner, and it's all thanks to you. Support future BC students. Please give today.
Thank you so much for the video there. And sorry, I kind of got us a little bit mixed up there. I was getting messages and they were coming in a little bit more quickly than I could read there, because I was so interested in what we were speaking about. So Sophia and Patience, thank you both so much for coming today and for sharing your thoughts with us. I think it brings a lot of conversation to the table. And sometimes it's not conversation that's always easy to have or comfortable, or we don't always have the answers, but at least having that conversation and how those things intertwine with housing and those things all, it all kind of fits together, and it's all part of the big picture. We did receive one last question in the Q&A. And so I wanted to make sure that I jumped in really quick and got that out there. So Debbie asked, where is the greatest need for scholarships in the medical programs you provide? And I think the answer to that is all of them. So we have lots of students that need to come into our program. There's a huge need. We have an aging population in the United States, everywhere really. And we need to make sure that we can provide those services. But we want to make sure that the students that we are bringing in have the capability and the funding to be able to do so, just like you just heard from our student there. It does make a difference. It did make a difference to patients. So I think anywhere in the medical community, scholarships are 100% needed, to help continue to support our students here at Bellevue College. And we are already very grateful for those gifts that we have already received and that we do continue to receive. And, just the opportunity to be able to continue support students and even support students in a greater manner makes a big difference. So kind of one last thank you to Sophia and to Patience. You know, I know that I'm not the only one that was inspired and learned so much from our speakers. I have some things kind of rattling around in my brain, maybe to bring to the table next time I have the opportunity. A big thank you to Interim President Governor Gary Locke. You know, and again, Sophia and Patience for joining us and sharing experiences. Thank you to so many of the individuals that have already made a gift in support of BC students. And for those of you who haven't, thank you for joining us. We hope that you'll consider making a gift as well. On behalf of the Bellevue College Foundation, I would like to say thank you to each and every one of you for your support. Thank you and have a good night.